I forgot to bring up. Anne-Marie's just going to stick her hand in there for us and tell us what that. Just mush that around and hold it up for us.
Yummy.
Oh, thank you. We just wanted, what does that feel like, Anne-Marie?
Just sticky and
hold that up.
And
Thank you, dear. And good luck washing that off with warm water and soap. You know, animal fats stick. They stick to you. And we just wanted to illustrate that. But what happens after you eat? What happens after you eat a high-fat animal food type meal is your blood cells start sticking together. And it takes up to 12 hours to get your blood flow going back to normal, which is very fast. After a high-fat meal, the blood will start sludging along at a much slower pace. You know, so many of the signs that we experience of aging in our country, it's really animal fats in our arteries and veins, and over time, it starts weakening all of our systems. If you think about it, you know, your eyes and your ears and your organs, every part of our body needs oxygen and nutrients. And it's our blood that carries oxygen and nutrients to every part. So by delaying that system, it's just very damaging in so many ways. Now, my mom always had a coffee can growing up under the sink. Anyone else have a coffee can under the sink? You know what that's for, right? It's the bacon grease. And you know, when my mom would make chicken soup and we let it cool and harden and you'd peel off that orange fat and stick it in the can? Yeah. We don't want to clog our kitchen pipes with animal grease. You know, most cheeses are between 73 and 91% fat. And most meats are between 65 and 94% fat. It's high-fat food. And if you're trying to get your nutrients by eating an animal muscle, you're not getting the nutrients from the source. That animal already ate the grass or the grain or the leaf. What you are getting is the animal's stored up fat and cholesterol, their storage of hormones. We don't want any more hormones in our diet. You're also getting the animal's store of fat-soluble toxins, and you're not getting one very important thing. You're not getting 1 ounce of fiber. There is no fiber, nothing, nada, zero, zilch, in any animal food. Fiber is like the janitorial system for our body. It sweeps away the toxins and the garbage and keeps things moving along. You know, we probably still have yet to learn how vital fiber really is. Now, all the meat eating we're doing in our country, too, it's just having the ramifications for the environment are staggering. We are destroying the Latin American rainforest to provide grazing land at just nightmare pace. Over half the water in our country goes to factory farmed animals. It takes 2,500 gallons of water to produce just a pound of meat. The meat industry is causing more water pollution than any other industry because we're outnumbered in our country, animals to be slaughtered to people. They're producing about 10 times more excrement than the entire human population, and they don't have toilets and sewage systems and treatment plants for all that stuff. So the runoff is ruining our rivers and our lakes. Now, I know this is gross stuff, but this is the kind of stuff that they're feeding the animals in these factory farms today. Stuff like shredded hay or shredded newspaper, plastic hay, processed sewage, cement dust, poultry litter. I'm sure most of you have heard by now that most of the animals are injected with hormones. And over 70% of the antibiotics in our country are not used for people. They're used for the animals in these awful conditions. And of course, they're getting ground up dead animals. Howard Lyman is the 4th generation cattle rancher whom was sued along with Oprah Winfrey when he exposed on her show that we were in fact feeding dead animals back to animals as feed. This is a quote from Howard Lyman. "I believe if the viewing of slaughter was required to eat meat, most folks would become vegetarian." Unfortunately, we're probably going to hear a lot more about mad cow disease, and Howard has educated me a lot about mad cow disease. This was on the cover of the Tribune. U.S. expands testing for mad cow disease. You know, you might be asking yourself about now, okay, this is all interesting, but really could I get everything I need without eating, you know, milk and meat and fish? Well, the biggest question I've been asked as a vegetarian is, where will I get all my protein? That is really a myth. If protein were really an issue in America, I think you'd be hearing conversations something like this. Hi, Mary. Oh, hi, Susan. How you doing? Really not good. My sister's in the hospital. She has protein deficiency disease. Oh my gosh, protein deficiency disease. My brother died of that last year. My uncle died of that last year. What are they doing for her? Oh, they're giving her all the bacon and eggs for breakfast and chicken or turkey for lunch and fish and beef. She's just still not getting enough protein. You all know people dying of protein deficiency disease happening. They're dropping like flies, right? That's not our problem. You know, the recommended daily allowances for protein were based on, in our country, on studies that were done on rats in 1914. Rat milk is 49% protein. Now imagine for a minute how much human milk is. And remember, this is the time when the human being is growing the fastest, that first year of life. Nature would be sure to provide the correct amount. Does anyone like to guess? It's 5%. Of all the calories that the human baby consumes, 5% come from protein. We adults don't need more than that. The World Health Organization suggests an ample margin at 2.5% to 8% of all your calories come from protein. Now you might be thinking that, oh, more protein would be okay though. I mean, more protein can't hurt, right? Well, no, that's not really true. It does hurt because animal foods are too acidic in our body. All fruits and vegetables are alkaline or base. Even things like tomatoes, lemons, and limes that you think are acid are really alkaline in our system. What happens is when you eat animal products and you get this high acid content, your body tries to stabilize your pH level by drawing an alkaline substance called calcium from out of your bones. This is a medical fact. It's been proven over and over again. It's called protein-induced hypercalciuria. What it means is that every time you eat animal foods, including drinking cow's milk, you'll be urinating out your calcium for the next couple hours. Osteoporosis is not a disease caused by not getting enough calcium, as most people believe. It's by eating too much animal protein. This chart just shows you that so with the protein intake goes your calcium loss. Now, if eating dairy foods were some kind of solution, what you'd find would be that the countries with the highest level of dairy consumption would have the lowest level of osteoporosis. And what we find is the exact opposite. Those countries with the highest level of dairy consumption, which are Finland, Sweden, the United States, and England, have the highest rates of osteoporosis. Another myth is that chicken or fish are somehow healthier for you than pig or cow. Well, I'm going to tell you 6 reasons why that's not true. While chicken or fish can be lower in fat, they have about the same amount of cholesterol. In fact, chicken and beef have like the same amount of cholesterol. So you're still going to be getting cholesterol. You're also going to be getting the hormones from that animal. You're going to be getting their stored up toxins like mercury, for example. You're not going to be getting the nutrients from the source. Remember, that animal already ate the grass or the grain or the leaf. You're not going to be getting fiber at all. And you'll be urinating out your calcium for the next couple hours after you eat it. Animal muscle is animal muscle, whether it swam or whether it walked or whether it flew. Now you might be asking yourself, why doesn't my doctor know about some of this stuff? You know, doctors used to prescribe cigarettes to their patients. I believe a very similar situation exists today with meat and dairy. You know, doctors just see the same kind of ads that we do, and they just don't know. You know, the average physician in our country received less than 3 hours of training in nutrition